So what are 5 signs that therapy is going well? Tune in to find out. Dr. Martin here. So many times we focus on the things that drive us to therapy without identifying signs that all the hard work that you're putting into therapy is paying off. So I have 5 signs that let you know that therapy is going well for you. Number 1, you are more comfortable advocating for yourself. Many times people come to therapy seeking ways to empower themselves in their home, in their job, or even just in the world. When you have been putting in the work, you may realize that your voice shakes a bit less when you're standing up for yourself. Or you only have to hype yourself up for 5 minutes before taking a stand, and previously it took 10. Or, and this one particularly resonates with me, you are more comfortable making changes, speaking up, and walking away from situations even with the fear being present. Identifying and acknowledging the fact that there's a healthy amount of fear and you still have to work your way through it. 2, you are less irritable. Low frustration tolerance or high irritability is an indicator that something is wrong. You are not meant to be walking around the world with a funky attitude all day. And so many times we get so used to feeling awful and going from 0 to 10 real quick that we can't even pinpoint when things went from bad to worse. Just because you can't identify the source doesn't mean it's not there. It's very easy to get to a 10 on the anger scale when you wake up at an 8 every single day. So when you start to see an increase in your mood and things start to become more enjoyable for you again, and there are clear signs that you're looking forward to the next day or the next moment, those let you know that mental health is improving. 3, you start accomplishing the goals that you've set in therapy or goals that you wanted to achieve outside of therapy. Therapy and goals go hand in hand. They really help to give you a barometer of what's going on with you. 4, you may also notice a decrease in physical symptoms that you were suffering from. The mind and the body are linked. Mental health is physical health is mental health. So you may find that you're sleeping better. Your headaches have decreased. Your back pain has decreased. We hold a lot of tension within our bodies during high times of stress. And when you start to find more ways to manage the stress, the level of tension starts to decrease. And finally, 5, you're starting to have less and less to talk about in therapy. Now, these are not all the signs, but there are some pretty good ones to look out for. And it doesn't have to be every single one in the first place. Therapy is not a linear process. It will have its peaks and it will have its pits, just like life. But you may notice that you go to therapy and you're like, talk about today. Or you notice that you can go longer without a therapy session before you need a booster. Sometimes with my patients, we'll do weekly sessions to start off. And then when my patient has stated that, I feel like I'm doing a little bit better, because we collaborate on goals and therapy is their space to identify that, they may decide that they want to go to bi-weekly sessions. And then they may decide that they want to do booster sessions, which is once a month or once every couple of months, right? Therapy is very much a collaborative experience. It's your space to share. It's your space to identify your goals. I collaborate with you to help you achieve those goals, but I'm not there to tell you what to do. You're always going to be the expert on you. I'm going to be the expert in the room when it comes to psychology and mental health and the integration of medical and mental health and things like that. But you're always going to be the expert on you in the room, right? So when it comes down to it, therapy should be a place where you're also able to model that appropriate relationship of being able to validate yourself and empower yourself and say, I was doing weekly before. I don't think I need weekly as much. I need bi-weekly. Or, hey, I was doing bi-weekly and I need to go back to weekly. Something has changed. There's been a transition in my life and I need to change that. So, not exhaustive. However, some really good signs to look out for to let you know that you're putting the work in. Therapy is work too. So, thank you for coming to our YouTube channel. Thank you for tuning in. If you like what you heard, if you want to comment, please do. If you didn't like what you heard, please comment as well and subscribe, just so that I could just keep you fully stocked in that haterade that you like to sip on. Because how could you not like this? Subscribe and follow me on all the channels. I'm on the Instagrams. I'm on the TikToks. I'm not really on the Twitter. I think we all know why. Have a good one.